Good morning, everyone. My name is J.D. Brooks, and I have the honor of serving as the chair of the 2026 Human Services Council. On behalf of the council, I'd like to welcome you all to today's presentation. We're here for the 2026 Health and Human Services Report on Community Health. After I'm done talking, you're going to hear from a number of experts in their field, which we hope will provide some valuable information. I'd like to welcome you live in our audience, as well as those observing this program on MCTV, which will be available in the future to view. Just quickly, a little bit about the council. Here's our mission statement. Essentially what we do is we bring together various service agencies, social service agencies in Midland County. I actually counted 27 of them that we currently have. And the idea is that we work together, we collaborate to make our community a better and safer and healthier community for everyone. A little bit of our history. In 1980, the Early On program was formed that started this process of bringing agencies together for collaboration. In 1983, the Health and Human Service Council was actually first established, and that became our state-recognized multi-purpose collaborative body. In 1998, United Way really stepped up and became the backbone agency of the Service Council, providing logistics and support and organization. And in fact, last year, the council went through some strategic planning efforts, and that was largely led by Holly Miller and United Way that she'll talk about in a minute. Again, really what we're trying to do is provide more efficient and effective social services and health procedures in the community with less duplication and coordinated efforts. Who we serve, that's real easy. We serve everybody in the community, from newborns until senior citizens. As you can tell this morning, some of us are getting pretty close to that. So we serve everybody through all walks of life, and it's very important that we do that. And of course, we fully support the community vision statement. That's what we're all about. Midland County, an inclusive community, together, forward, bold, an exceptional place where everybody thrives. And with that, I will turn it over to Holly.
Good morning, everyone. Holly Miller with United Way. And I thought it might be helpful to just ground us in some of the strategic changes that we went through as a council. It was a very collective process, and I thought it might be good to just kind of go through that quickly as well. You know, every system has its pieces and parts, and I thought it might be helpful to see how they all fit together. So we have an executive committee, and as JD talked about, we are the backbone. Really, we're a support organization to make sure that we work behind the scenes to make sure everything works together. But that group really looks at governance, strategy, how do we set up communication and engagement. But I really wanted everyone to see how this works bidirectionally, right? We have prioritized work groups, which you're going to hear about today. But also we have a vast amount of members. But it doesn't stop there. Really, those members are representing our community. And we all have unique ways that we engage with people in our community and the people that we serve in our community. And it's really important to have bidirectional communication working all the way through the levels of health and human services. We serve this community. And to do that, we have to work collaboratively with every group in our community. So we have magic that kind of happened this year. This doesn't often happen. One of the things we went through in strategic planning was really identifying where are our sources of data that help guide our decision-making and help guide us setting priorities. And so all the stars aligned for 2025 and 26, where we have the health study, which was updated in 2025, and you're going to hear a lot of data from that. The ALICE report, which used to be on a 3-year cadence, is now in a yearly cadence. So we have access to that data on a yearly basis now. Also, the great work that's happening with the Legacy Center around the youth survey has completed, and we have results. But also we're doing the older adult and the adult survey. All of that data will be in a single 18-month period, as well as the housing study that was done regionally in 2025. So I share all of this because these are our sources of data that we kind of use as a touch point, and we have them all at our fingertips in the next year, collectively, which is rare, as you know, in the data world, to have it all kind of collectively in a place where we can action it and assess it. So One of the things we really look at is our shared framework, right? When you think collaboration, it's always about the many, it's never about the single. And so one of the things that we really try to help facilitate is setting priorities, understanding what's happening in the community, what is the lived experience of the people we're serving, and what should be priorities that we establish. Also looking at not just how we measure success at the program level or at the committee level, but also what are the shared outcomes? What do we hope to see happening in our community over the long haul? And I think this is one that's really exciting for me, is that cross-cutting themes. We know that if someone is struggling to afford housing, guess what? They're also probably struggling with food. They may be struggling with literacy. They may be struggling with a whole lot of things. And so that cross-cutting themes is really important, that we have cross-functionality, and we're talking about the very priorities in a way that we can better understand the lived experience of the actual people. Again, this helps us to have evidence-based conversations. Data, as we just shared, our primary sources of truth. This allows us to have that. And we love this shared accountability model, right? We want to make sure that we're working together to better understand what is the collective outcome we're trying to achieve. And then collaboration is the theme of today, really. It really takes all of us working together to truly impact our community. And I think Midland does that better than most. I'll pass it over.
Hello, I'm Rob Worsley. I'm the Executive Director of Midland Community Former Offenders, and I'm also the Chair of the local planning body. Joe and I are going to talk about affordable housing that we work through with many constituents, agencies, nonprofits in the community to try to provide housing for people less fortunate than ourselves, those in the ALICE population, and those living in poverty. The local planning body purpose is we address affordable housing and homelessness in Midland County by uniting stakeholders, advocating for underserved people, and providing diverse and innovative housing options through collaboration and resource sharing. We foster collaboration and systems-level solutions, focus on prevention to ensure homelessness as a one-time brief occurrence, excuse me, and we increase availability to safe, affordable housing for all. The local planning body, okay. Oh, I'll get it together here pretty soon. Okay. As you can see, there are many members to our local planning body team. We actually have over 30 nonprofits, community agencies, as well as local volunteers that make up our local planning body. Some of you may have remembered it as the Continuum of Care or the Homeless Coalition in Midland, but we have been referred to as a local planning body for quite some time now. Our main this group comes together to help eliminate homelessness and assist those that exist in the ALICE population as well as those in poverty with sustainable, suitable housing. I don't know why I keep going the other way. Affordable housing goals are to increase the number of affordable units by having stakeholders engaged in planning, prevention and education, and advocacy. What we're trying to eliminate is those who are homeless that we get housed and shortly thereafter they're homeless again. We do that through collaboration with many agencies and try to educate them on ways that they can stay in the housing that they were afforded and how we can help them to make sure that they do that. How we measure success. Obviously, a decrease in housing insecurity and homelessness over time, an increase in affordable housing units, successful transitions of individuals from supported to independent living, reporting and communicating progress and success to the community, tracking the number of families housed and maintaining stability, and developing a strategic plan with clear goals and measurable results. By increasing the number of affordable units, we inventory what is available, maintain and improve relationships with landlords, coordinate, prioritize, and match people with services that they need. As I said earlier, we stakeholder engagement planning. We engage in more public relations around affordable housing with prevention education through resources, advocacy and access, and policy and implementation for access through coordinated entry system, improving coordination and system entry services.
Good morning, everybody. I'm Joe Coffey. I'm the CEO of Home to Stay here in Midland, and we serve as the HARA for Midland County, which is the Housing Assessment and Resource Agency for our county. So my role on the local planning body is to serve as the HARA representative alongside Rob as the president of the local planning body, and Kim Stuhler, who everybody in this room already knows, as the secretary of that group. Rob mentioned that one of our goals, of course, is around looking at affordable units. And the other goal, kind of on the other end of that spectrum, is to ensure that when homelessness does occur in our county, it's a one-time brief occurrence. And we do that by looking at housing really as a continuum of housing needs. And so what you see on your screen is a graphic that many of you have seen some version of in a presentation, looking at housing needs all the way from homelessness through the purchase of a market rate home. And so when you think about things like the prevention of homelessness, being homeless, experiencing homelessness or housing instability, utilizing emergency shelters or transitional housing and social housing. And if you aren't familiar with social housing, think Cleveland Manor in our community. That part of the continuum is really the work that the local planning body is focused on. And so those 30 plus agencies that Rob mentioned, along with members of the community volunteers, and members of the faith community, we're working hard so that when we are meeting people wherever they're at on this continuum of housing needs, we're able to kind of hold hands with them and with other agencies and move them through the continuum through whatever success looks like for them. So success may well look like the purchase of a market rate home for some families, but that's not what success looks like for everybody. Perhaps finding an affordable rental that they're able to sustain on their own without community assistance and the assistance of the local planning body, perhaps that's what success looks like for some families, and that's okay too. And so we want to make sure that, again, we're not leaving people where we find them, we're moving them through this continuum. I see why you move backwards on the slides. Another piece of the work that the HARA is responsible for on behalf of the local planning body is the annual point in time count, or PIT count. And so what we do, and many folks in the community know because you've heard me reach out and call for your assistance, we go out one night in January. It's the last Wednesday in January in the evening. And no, I did not pick that time. And yes, I write a letter every year to HUD that says, have you ever been to Michigan on the last Wednesday of January? And so from the numbers that you can see, you're able to recognize that since 2020, the number has more than doubled. And I am able now to share the official numbers for 2026. And it may appear when you look at this slide that we've had a slight decrease, and that's sort of true. In years past, we have been able to count the number of folks who are doubled up in that number, and this year we did not count those. So if we added folks who are doubled up, and so if you're not familiar with that term, think couch surfing, or if I were to, for some reason, need to leave my living situation, and my friend Sharon said, you can come and stay with me, I have no legal right to be at her house. She's just letting me stay there. If we count those folks who are doubled up, you can easily add 26 more folks to the number from 2026. The reality of all those numbers that you see on that bar graph is that it's probably really more than double. Folks in the homeless community are very, very resourceful, and by the time it gets to be 5 o'clock on a January night in below freezing weather, they have found a solution for themselves for that night. So it's difficult for us to find these folks and interact with them. We do work with the local shelters, and we work with all the agencies, of course, in the continuum or in the planning body, but also with agencies that you might not think about, like local law enforcement, the hospitals, the library, to find out where folks might be. And we do go out onto state lands, and you know, I'm going to nod my hat to Rob there because he always leads that effort, and walk those properties and look for folks to interact with. So that's one data point that's really important in the local planning body, and it's important in the story of Midland County because this number that we report on an annual basis impacts funding not only that Home to Stay gets as the HARA, but that many of the agencies in this county get who might be serving some support service for housing. Another data point that's important is the area median income. So you'll hear me say a lot of times, and people from the planning body or Jen Acosta from Housing Forward use the term area median income or AMI. So just for clarification, the area median income is truly the midpoint of this county's income distribution, meaning half of the people in this county make more than that, half of the people in this county make less than that. So how does that impact housing? And so you'll see kind of in the blue graph where we've listed deeply affordable housing, workforce housing, and market rate homes. And so, for instance, if you're looking at somebody who is right at the 100% AMI, area median income, that person is likely to fit into workforce housing. If you're looking at someone who's making 60% or less of the AMI, that's where Home to Stay might come in as an example. That's where someone is going to be looking at deeply affordable housing. So this slide, I cannot take credit for. This comes from Housing Forward, again, the brilliant mind of Jen Acosta. And it really is intended to show the kind of supports we need for folks to move up to the next level and what can happen in terms of safety nets and also what might happen if they have a spiral or a crisis. And so if you're looking at workforce housing, which is that 80 to 120% area median income, ladders in this situation are really critical. This is where we're looking at folks moving toward home ownership, moving toward generational wealth and wealth building, career growth. But one health crisis, one job loss, one emergency can trigger that rapid spiral down if the safety nets are not in place. And you think about affordable housing, so 50 to 80% area median income, they're less reliant on the safety nets because they've created some for themselves and their family members, but still very reliant on ladders to move up to that next level. This is where you're thinking about programs like home repair. You're thinking about down payment assistance programs, financial counseling, credit building programs. Again, pathways to home ownership and generational wealth. Finally, when you look at deeply affordable, so folks who are really at 40% or less of the AMI, both the safety net and the ladders are super, super critical. We're talking about folks who really need concrete basic supports, health supports, transportation supports, assistance with food, assistance with childcare. And so we really, as a local planning body and as a community, I'm proud to say, look at housing needs as a wide continuum, and we are really responsible as a community for creating those ladders and creating those safety nets and keeping those intact. When you look at what gaps we might have, these things that you see on the screen, I'm going to go over. This is as part of our Housing Forward Coalition's report, but it's definitely also based on the Bowen National Research project that was recently completed in 2025. And so thinking about Midland County only, the larger report looks at Region G, which is an 8-county area, but the data that you're seeing here is for Midland County only. The area median household income is $80,852. The fair market rent for a 2-bedroom in this county is $1,137. And the median home price for the county, not the city of Midland, the county as a whole, is $235,000. So we're looking at around 31% of the population who rent would be cost burdened. And toward the bottom of the screen, you'll look at some of the most frequent occupations in our county: production workers, retail supervisors, elementary school teachers, nursing assistants, and restaurant cooks and staff. So you can look across there and you can see sort of the median wage of those, and then you'll see, can they afford to rent? Yes or no? Can they afford to buy? Yes or no? I don't need to go any further in detail for you to see that the answer is more no's than yeses. And so only about 34.3% of the occupations listed here can afford the fair market rent for a 2-bedroom, and only about 11.4% of the same occupations can afford to purchase a home in the county. So if you think about that, what does that mean to us? What gaps do we have in the units that we have? What gaps do we have in the affordability? When you think about the household income, which runs across the top of the graphic you see there, the rent income and the price range, it can show us a rental gap leading up to the year 2029. So between 2024, when the Bowen National Research report began, and 2029, we are looking at a gap when we get to 2029, if we keep at our current building rate, of 311 rentals for folks who are below 60% AMI, 61 to 81%, 200 rentals, et cetera. And where it really gets kind of interesting and heavy for our county to think about is between 60 and 120% AMI, the number of for sale gaps is more than 3,000, as you can see. So that's a part of the conversation of the local planning body. How do we create these affordable units? How do we work with existing landlords? How do we rehab properties that are already here? We're really blessed to live in a county that takes this seriously. The county government, the city government also takes this seriously, and to have the number of organizations working on this as a team that we have. So I'm really proud to be part of that. Rob?
So impacts and wins. Joe touched on some of this. We have 2,317 inquiries for housing assistance were answered. 218 clients were supported in rapid rehousing program through Home to Stay, serving those who are homeless. The regional housing study completed in 8 counties, driven by Housing Forward, and $89,000 were invested through the LIFT for housing-related assistance. Did you want to speak on Whispering Pines?
Yes. And another win for our county has been the impact that we've had at the Whispering Pines Mobile Home Park. We have been able to support 65 families for 7 weeks with their basic needs, including water, but much beyond water: food, clothing, hygiene kits, feminine hygiene products, washing of clothes, getting folks transportation to the things that they need. We have secured over $10,000 in in-kind donations. And when I say we, I'm not talking about Home to Stay. I'm talking about all of the agencies involved in the local planning body. We've invested nearly $6,000 in the direct purchase of humanitarian supplies and raised nearly $4,000 from the Midland 100 Club. Deployed 86 volunteers who have put in over 400 hours invested. So the park is currently licensed, and they currently do have what Eagle tells us is acceptable water pressure. With Project Community Connect, which is again a function of the local planning body, we had 176 community members who were served. 35% of that number reported being homeless on that day. 35 agencies were there to wrap around those folks and provide the best services possible. And we had more than 75 volunteers who supported that event. So Rob's going to share some actions that you can take as a community member to help support the work of the local planning body.
Our project, Community Connect, that Joe mentioned, is a yearly program that we have that Trinity Lutheran Church hosts us for, allows us to use their area or their building, their meeting room, as well as their kitchen. And it is well attended by many people who are hurting in this community, and we're grateful that Trinity allows us to use that space. So the actions that we can take, spread the word about 211. That's our main connection hub there that people can call that need whatever type of assistance they may need. And then they will send those people to the agencies and nonprofits in the community that will assist with whatever their needs are. People need to speak up in regard to policy and housing decisions in this community. We have a lot of people that are in need of lower income housing. Probably 98% of the clients that come to Midland Community Former Offenders, and many of those that show up at Home to Stay and other agencies cannot afford housing, as Joe showed you in those graphs. We need to check on our neighbors, make sure they're okay, make sure they're doing well. You know, it's unfortunate. We live in a society now where most people don't know the people that live right next door to them. Nobody gets out, nobody talks, nobody engages. And I remember when I was a kid growing up, if I did something wrong in the neighborhood, my parents knew about it before I got home. Or if, fortunately, those few times I did something good, hopefully the same thing occurred. But we need to know who's living across the street from us, and if they have needs or if there's things going on that we can help with. And as always, lend your help as a volunteer. There's always opportunities in this community to help others less fortunate than ourselves. And so if everyone would take that opportunity to do that, it would make our community a much greater place to live. Thank you.
All right. Well, thank you, Rob and Joe, and really appreciate the work that they're doing on housing. So we're going to shift gears and talk about the Health Committee, another aspect of what Health and Human Services does. My name is Sharon Mortensen. I serve as President and CEO at Midland Area Community Foundation. I'm also Chair of the Health Committee, and presenting with me is Sam Price, who's Vice Chair of the Health Committee and serves as President and CEO at 1016 Recovery Network. So let's talk a little bit about the Health Committee. And the Health Committee really is a cross-sector group, as you've heard already, around housing, around health and human services. We have over 20 organizations that come together that work on health-related issues. And as we talk about health, we're talking about physical and behavioral or mental health. We're talking about both. And all these folks that come together are very concerned about health, and we see the interconnection of so many factors when it comes to health. So the purpose of our committee is to assess and evaluate community health needs. So that data that you heard about, and we're going to highlight two specific parts of that we use quite a bit, that all helps to inform our work. We help to develop and implement a community health improvement plan. Now, this is something that's done for communities across the state of Michigan and across the U.S., and that is they come together and they say, what are key things we need to work on? And they develop a plan, a community health improvement plan to address those issues. And then we track progress on our health goals. Is what we're doing working? Are we seeing the results that we want? And where do we need to shift, and so on? So this morning we're going to, I'm going to share data on what's informed our work. So you're going to hear some data first. I'm going to look at the accomplishments. Well, Sam and I should say, the royal we are looking at this, at our accomplishments over 2025. And then we're going to share what we're working on this year for 2026. So first of all, what informs our work and our priorities? Well, you heard about the Midland County Health Survey. This is conducted roughly every 3 years. I know it's something that my Michigan Medical Center has to have as part of their work, and it's something that our community needs to have as well. And so we conducted this in the fall of 24 into winter of 25. So last year, we did spend some time doing presentations talking about what did we learn from this study. And it reinforced the current areas of focus of our health committee. So when we looked at the information, we said, this shows that we need to continue to address these areas that we'll be talking about here in a moment. You can view the full report on the Health and Human Services website. There is a lot there. And we partner with Saginaw Valley State University, and if there's anything you see there that you say, I'd like to know more about this specific category, we can dig, they will dig into it with us, and I know they've done that on a number of occasions. The other important piece that informs our work is the Midland County Youth Asset Survey, which was conducted by the Legacy Center for Community Success this past November with 6th to 12th grade students taking this. That looks at developmental assets and risk-taking behaviors. You can view the results there on the Legacy Center's website as well for all of that complete information. So as we look at what we have done and what we're doing moving forward, these two are probably the most important pieces of data, the most important information that we use to help inform that. So let's talk a little bit about health here. And again, we're going to get into the data first. So this was given to adults. So these are adult results that you're seeing on this screen here. So we said, how do you perceive your health? Is it excellent, very good, good, fair, or poor? And what we saw was a decline over time in people that saw their health as excellent, very good, or good, and an increase in those that saw their health as fair or poor. And this points to a lot of things. And remember, this is looking at health, both physical and mental health issues. So people did not see their health as good as they have in the past. And so some of the strategies you're hearing about are designed where people can impact their own health, things that they can do, strategies that help to do that. So you'll see some of that as we look at this. And then we talked about health conditions, and we said, have you ever been diagnosed, this again is adult information, with one of these conditions? There was an increase, as you can see, in mental health and substance abuse disorders, what SUD stands for, diagnoses. So if you look at the anxiety number, around 50% of our population say they've been diagnosed with an anxiety disorder. Depression, almost 40% there. We also saw an increase in asthma and diabetes-related conditions. There were some good news there too, so we don't want to just call your attention to the bad news. There were good news, a decrease in hypertension, cancer, and heart conditions. So that's good, but also what you're seeing here in terms of the increases are some of the things that we're focusing on in terms of our strategies. And then another thing that we looked at in this was obesity. And this, again, is from the adult health survey. We saw that there was a increase in those that were overweight. Excuse me, there was a slight decrease in those who were obese, but a decrease in those with normal weight. So again, this forms some of our strategy. How do we get people moving, active, doing things that they can do to help improve their health? So these are some of the results here, and then we've got some more to come here.
So understanding the complexity of who we are as humans, we understand that it's not just how we physically feel. Sometimes it's also about how we are feeling from a mental, emotional, psychological, spiritual aspect as well. And so, as you can see, we can't necessarily understand, am I depressed because of my heart condition, or am I anxious because of my cancer, or has my cancer made me more anxious? We don't know. That's some of the complexity that we have to evaluate. But we're also looking at how are some of our lifestyle choices and changes in habits also beginning to impact some things. So for the first time, we really started diving into how does some of our social media behavior and our screen time behavior begin to show some correlation of this. We don't know. It's a chicken and egg kind of conversation. We can't say, increased screen time is creating depression or anxiety, or is my depression taking me to the screens? We don't know, but we know that there are issues that are there, and we have a responsibility to evaluate it. So what we did is we looked at when you are having to have intensified screen time in the course of your day and your week, then how is that correlating with signs and symptoms of depression or anxiety? And it's whether it's for work or for pleasure, and regardless of the means, whether it's a computer, a TV, or a smartphone, we're seeing that there are significant impacts of both of those. We don't know exactly what the root cause is, but it gives us a starting point of ways that we need to look into it and evaluate it and try and figure out how is that even correlated with some of these perceptions of health and some of our physical activity and things along that line. If I'm spending 8 hours streaming, well, I'm not very physically active. I'm not very engaged with other people unless I'm gaming with somebody, things along that line. So those are some of the dynamics that we're also looking in. Because what we're also seeing, again, when you try and evaluate the holistic nature of our human condition, we're also seeing that there is another correlation for those people that are feeling that they are more socially isolated, in spite of what social media says is going to connect the world, right? For those people that are feeling more and more socially isolated, their possibility of being diagnosed with depression or anxiety have gone up substantially to those that feel like they have better connections with real humans in real time and in real life. And so it's, again, how do we get into understanding how that plays out in the overall health conditions of the people that we're working with? We also then went further with, thanks to the youth study from the Legacy Center, looking at our young people as well. From 6th to 12th grade, what are your perceptions of and your feelings of depression, anxiety, eating disorders, and attempting suicide? And you can see that for most of those are trending up. 1 in 5 of our students across the county are expressing senses of depression across all grades, really. They get more anxious as they go further along in their experience, or more of them are experiencing those senses of anxiety. More of them are having that translate into eating disorders. More of them have, attempted suicide in some kind of fashion. Those are all troubling things that we need to figure out how do we wrap around them differently and address things holistically in a kind of a joint effort. And then staying into that same mode, what are some of the things that we see if we do this overlay of the lifestyle of how social media has impacted our youth, because we know it is such a dominant behavior for so many of them. And what you can see based on use, again, we don't know, we can't say it's causal, but we know that there is some kind of correlation, that the more that they are embedded in social media, their rates of depression go up, their rates of anxiety go up, the eating disorders go up, their suicide attempts go up. And at the same time, what is going down? Their sense of purpose, their sense of self-esteem. Again, I don't know if it's chicken or egg, what's causing what, but we know it's real. We know that we need to find strategies. We need to know what are the collective assets that we as a community can wrap around them in ways to reduce some of those risk factors and improve more of the protective factors that are around them. Then getting into the area of substance use, what we are finding in many ways that as much as the thriving community that we are no different than the rest of the United States. When you look at national statistics, 1 in 10 to 1 in 8 of us, if a person was feeling safe enough to fully disclose what their relationship is with alcohol or drugs is kind of looking like, would probably meet criteria for a substance use disorder. What we see from the survey information as we look at people and some of the consequences of their use for both alcohol and drugs, we're right in that same spot, right around 12 to 13% of our general population has that kind of likelihood of having some kind of substance use disorder. Even at the mildest state, it still means that is there. Now, what is more particularly interesting and needs to be pointed out, particularly within the alcohol subset, that cuts across all income levels, that cuts across all educational levels. And in some ways, the risk prevalence is even higher for those that have higher education and those that have higher economic status. It is not just a poor people situation, which often is the way that it sometimes gets perceived. So we have work to do, because if you look at that 6 and 16%, that represents the number of people that we surveyed that actually sought help in some of these circumstances. The national statistic is of that 1 in 10 that might meet diagnostic criteria, only 10% of them are seeking help. So we're seeing that those that have encountered some struggles with drug use, 16% of the folks that we talked with were courageous enough to say, yeah, I sought help. Wonderful. We got a long way to go as it relates to our relationship as a community with alcohol. And you can see this. Now, these data points represent information from the Michigan Department of Health and Human Services. This represents those people who use the public system for their treatment services, and lists the primary substance of misuse that they're coming into treatment for and what they may be struggling with. You can see that, back in the day, opioids was the number one thing. We were in the opioid crisis, and that was driving everything. Alcohol has returned to its number one position. Alcohol kills more people in Midland County than opioids ever did. Let's be clear on that. It is still the number one killer. Opioids kill people suddenly. Alcohol takes more time. Alcohol has returned to number one. Opioids is still number 2 and still very dangerous, but coming up hot on its trail are stimulants, particularly methamphetamine. And both methamphetamine and a lot of those opioids that are out on the street, we don't know what's in them. And a lot of them have, fentanyl or xylazine or other kinds of poisonous types of substances that we also have to look at how we focus on helping all of them as we try and navigate this space. On the good side, while we see all these troubling things, we also know and are hearing that people are finding points of well-being. They are finding recovery from their depression. They are finding recovery from their anxiety. They are finding recovery from their substance use disorders. So that shows that while, yes, we got a lot of work to do over here, we always will as a community, we're also seeing positive progress in people being able to get to those points of wellness and sustain wellness that they can feel good about their future.
So the Community Health Improvement Plan, hearing all that data, so that's the context in which we're working as a health committee. So hearing that, these are the 3 priority areas that we have focused on. And what we saw really from both our health survey, the adult health survey last year, and then the youth survey, I know we had already chosen to focus on these, but really reinforced that we're focusing on the right areas right now. You can't take on everything, but you've got to focus on some things. So we're focusing on healthy living. We see the need for people to move, eat nutritionally, et cetera, mental well-being, and substance-free resilience. And so I'm going to just quickly go through in each of these areas what we've accomplished over the past year and what we're focused on this year that we're currently in. So healthy living, first up here. And so some of the accomplishments over the past year, and again, I want you to note that we have so many important partners like our Midland County Health Department you see pictured here, but some of the focus has been on nutrition, togetherness and belonging. And didn't that come through the importance for people to feel connected with others? And reduction in screen time. Now we know screens are here to stay. We can't say get rid of your smartphones. Mine is timing us to make sure we're within our time limit, but we can't say get rid of your smartphones. But what we can say is connect with others and have some time that you're free of screens. Have some time that you're free of screens. Some family mealtime community outreach, another great strategy that I know our county health department has really promoted. 8 events, approximately 950 interactions, educational interactions. And then preventable diseases, vaccine clinics. There were 32 community clinics this fall with walk-in and online appointments. And then also a community cupboard was put in at Midland Area Farmers Market so they can supplement. They might be using their SNAP benefits to purchase nutritional food at Farmers Market. They can supplement it with items available at the community cupboard there at Farmers Market. And there was a Midland County Health Fair this past August, over 500 individuals engaged. And this is a great opportunity to just bring people together and let them know what is available for them in all categories, physical, behavioral health, et cetera. Let them know what's available. So what's being worked on this year? What are we in the midst of? Well, doing more preventative health opportunities because that continues to be really important surrounding cancer, smoking, heart disease, obesity, and vaccines for preventable diseases. There's work underway to develop a health literacy toolkit that will show how to best advocate for your own health because at the end of the day, we want to empower people to advocate for their health. And then again, we'll have another community-wide health fair to make sure that people understand what resources are available for them. In the mental well-being category, as we look at some of the strategies around this area, we have a 211 mental health navigator. And this is an important resource. They can assist through calls, texts, chats, and longer appointments. And I wanted to share with you just a success story. A mother contacted 211 this past year seeking help for her child who was experiencing suicidal thoughts. The mental health navigator, because they reached out via text, immediately reached out, was able to get in touch with the mother, and within minutes got this mother connected with resources so she could help her child. That's pretty cool, isn't it, that we have that available. The Adolescent Intensive Outpatient Program opened through My Michigan Health, which has been a wonderful addition. You see the admissions, and here's a quick little quote from a mom whose teen participated in this. I am beyond grateful that My Michigan has a program to support teens through life's hardest seasons. During a really difficult time, this program helped my teen rebuild confidence and coping skills that will help him for the rest of his life. So that's a very exciting thing that has gone on. During the holiday time, And this came up at a health committee meeting. It's like, what can we do to help people? Because holiday time, it can be joyous, but it can also be very lonely, isolating, and difficult for individuals, especially those that have experienced trauma. And so we did a series of, and one of our, somebody from the health department said, we should do a series of posts about mental health resources. So we did through Health and Human Services, and those were well received. So we got information out. And then increased awareness, there's been an increase in people that are clicking on 988, which is a suicide prevention hotline, and mental health literacy across a variety of social media platforms, and more trainings that are going on. So these are some of the things that have happened. Goals, we want to complete those adult 60 plus thriving asset surveys. We want to continue to increase communications and awareness. We have a lot of resources here. People don't always know where to go and what's available. So continuing to increase awareness, promoting the 211 Mental Health Navigator, doing storytelling, and exploring solutions. The eating disorders thing, really, right now we're saying what is available and where are the gaps and what do we need to do. So that's being looked at right now this year. And then encouraging greater connection. People need human connection. They need that. We're just built that way. So encouraging greater connection are some of the things that we're working on this year.
And then our last group focuses on substance-free resilience from a holistic perspective as well, in terms of what are the work that we can do with our youth, what are the work that we can do from a harm reduction space, and what is it that we can do from a treatment and long-term recovery standpoint. And we were able to accomplish quite a bit over this past year. You know, part of it is, like I said, while there is the reality of active addiction that is going on and harm is happening because of the poison that's out in our streets. And so what are the things that we can do to help try and keep people alive? Because you can't recover if you're dead. Simple there. So we got, over 1,900 boxes of Narcan out into our community so that people can have that available to them as a tool to try and reverse an opioid overdose. We have been able, through the work of the health department, launch a safe syringe program so we can cut down on rates of hepatitis A and hepatitis C happening through shared needles and getting rid of that. Almost 250 medication lock bags were distributed so we can keep controlled substances safe in people's homes so that they can't get in the hands of, their children that are in that same home as well. We've been able to invest in trying to find pathways for people to have sustained recovery through our recovery-friendly workplace initiative, to work with employers to change their employment practices, to work with people that are in that recovery space so that they can get meaningful work, so that they can have sustainable housing, and get onto those points of well-being and satisfaction. And we continue to invest our youth, first by hearing from them, by getting 74% of our youth to participate in that study with the Legacy Center, lets us know where they are and how we can best help. We correlate that with developmental assets to figure out what are the best levers to help work in our community to make a difference and inform the 100 professionals that come to our 5th annual conference that we do with our young people to try and make that landscape different. Going specifically to that harm reduction space, one of the things that our group is really, really proud of is we have gotten these stations available throughout our entire county, so nobody has to go very far to get hold of life-saving materials, whether it's Narcan or test strips or other kinds of things. These places are available throughout our county and throughout our city in ways that makes it easy to keep people safe and reduce that risk of fatality as things go. And we're really proud of that. Where we're going in the future for 26 and beyond is particularly in our youth space. We're looking particularly at an anti-vaping campaign in some targeted locations because we see an increased use of that. We're taking that youth survey data and beginning to both have it feed our conference as well as some of our strategies in the area. We're looking at harm reduction in ways that we can continue to evolve resources that are available in those harm reduction stations. We're even looking at how we redo our Dump Your Drugs events so that we continue to get more things off of the street. And then from a recovery perspective, we're looking at how do we improve access to housing? Because if I have substance use in my past, I may have a felony conviction. I may have crappy credit scores. So for me to have a place in the line For the limited housing that's available, I'm even further down. How do we change that relationship within our community as well as get more employers to be open to working with people with this kind of history where they can openly have conversations are things that we're all focused on. And that, last thing, oh, one more slide, and then I can hand it to you. More actions. You've heard it before. Get your bodies moving. Get your folks outdoors. Get connected with real people in real time, in real spaces, hopefully outdoors, or maybe breaking bread. Those kinds of things. Places to find activities to get going is to use Max Midland. There's a wonderful calendar of events that you can use to help spur all of that stuff on. That's our work. We'll pass it on to you.
Awesome, good job. All right, hi, everybody. Emily Lyons with the Midland Business Alliance and the Midland Area Farmers Market. In the last year or so, we have taken a little bit of a more focused approach on food specifically. You know, all of the great work that has already been talked about and done, really you do your best as a human if you eat like 3 to 5 or 6 or 7 times a day, depending on what you need, right? And so we have decided to focus a little bit more, and I want to talk to you about what Food for Health is doing. All right, here we go. So we have almost 30 different agencies and stakeholders that are coming together about every 6 to 8 weeks. And we're talking about how we can make a difference in food security in Midland County. We're talking about transportation. We're talking about all the different things that people say are barriers for different levels. And I'm going to talk about that this morning. Different levels of access to food. Okay, so real high level awareness, right? Like, we need to know that not everyone has equal access to food in our county. We need to talk about it. We need to talk about how people can either get to the food or the food can get to them. And then talking about nutrition and affordable food. So under that, I think some of the things that I'd like to highlight is that having food and nutrition security, that's an investment in our future, right? If our young people are fed well, they can learn better. I see some teachers in the room. I think they can probably attest to that. Raising up and having advocacy engagements and community awareness to build support and reduce stigma, so that if your neighbor needs help and you're like, oh my gosh, like, we're in a nice neighborhood, I can't believe that my neighbor needs help, just be aware and maybe you can help them out. Transportation, weekends, limited service. Some of our rural parts of the county don't have even, regular, much less on weekend, reliable transportation. Better systems, so maybe bus routes need to be reconsidered. And then for those of us, since we do not live, next to a metro, transportation directly affects how much food people can take and how often. If you have to use public transportation, they will limit how much space you take up on that bus. And then, especially as the director of the farmers market, priority, and it's important to have calories, but priority needs to be on fresh produce. We do have local farms in our community, in our region, and then healthy food options, not just calories. And then reducing youth hunger, because again, like I said, that's important for learning outcomes. And that specifically and directly ties to quality workforce as those youth are coming out of high school, university, whatever. Here we go. So some of the things that we are doing to measure success, and I'm not going to speak on all of these, Andrea's going to talk a little bit, but upcycling food and reducing waste. There are lots of fun things that are happening both here and nationwide. Food independence, I think, is pretty important, as well as cross-agency and engaging businesses. And then realizing that 24 hours is a long time to go without any calories, and making sure that we're reducing that. All right, so one of the things that we talked about is that while we do have a focus on Alice and we do have a focus on those who maybe cannot afford food, that there is a food continuum. And this way it encompasses all of us, right? And so we go all the way from starvation to emergency, food insecurity, all the way to food independence, where this even is accounting for cultural preferences or needs, if you're halal or anything like that, and being aware and cognizant of those. All right, so a little bit of from starvation to healthy eating, what these descriptions mean for those stages, and then common indicators. I think, the things to highlight here are if you're starving, you see the photos of animals that have been found, right? And there are humans out there, we just might not see them, right? They wear baggier clothes or things like that, but malnutrition can impact a whole lot of issues with, your health, and it can have lasting impact. And so making sure that we don't have folks in that area. But then again, talking about how do we go from just making sure that we have calories up to healthy eating and food independence to make sure that we have the right nutrients for our bodies, that we have food literacy, and that people have choices. I know, the food bank and a lot of other places, even our community cupboard, people are like, hey, can we get some beans? And I was like, yes, we can get beans. We had a lot of great suggestions, and we're able to help people out. All right, yep, this is me too. Okay, so I want to talk about, got a lot here. Right, like no different than any of the other things that we have seen over the last decade, 2 decades. We have 5 years because, the pandemic changed a lot of things. And it also specifically, I know SNAP was mentioned earlier, but for those of you who are not aware, SNAP is Supplemental Nutrition Assistance Program. Depending on how you were raised or what your experience is, that's old school food stamps, right? That is funded through the USDA, through the Farm Bill. So just to level that information and make sure that everybody is aware of those governmental things. So this is the thing that I think is really important to tell everybody. In regards to the Farm Bill, the Farm Bill, so it includes the monies for SNAP, and we have not had a Farm Bill renewed since 2018. It is currently funded, but we are just living off of what was put in place in 2018 and nothing new. I encourage you, if that's something you're interested in, that you should look into that a little bit more. So again, I think what the takeaways on this is that about 60% of Alice families in Midland County are food insecure. And so that is because of how they're working or not able to work, or they're not eligible for assistance, yet they do not make enough money to be able to afford housing and everything else that they need. Okay. Oh, here's another one with lots of cool charts. So I think the interesting thing here is to show that 2021 and 2022, we had a huge spike, both in inflation, because the cost of everything was more, because production of things shut down. If you think about broccoli from the grocery store, 90% of the time it is wrapped in plastic, like right now, It might have come on a styrofoam tray. Those things may or may not have been produced in the United States, but that might or might not have been considered essential, and it might or might not have been, shut down. Or the raw materials actually came from overseas. All of these things are impacting the cost of what food is. And so, poverty increase has happened because of the inflation, because of that web. You pull on one little thing, right? And everything is impacted. And that, of course, we didn't go deep on childcare, but childcare is part of this along with the housing piece. And so the increase in cost of those things has also increased poverty and food insecurity. Oh, I'm over time. Okay, let's see. So I want to point out 2023 on this slide. So in regards to SNAP, in 2020, 2021, and 2022, there was pandemic EBT or PEBT, and the federal government infused a lot of money to help people to be able to afford food. And all of that went away in 2023, which directly correlates with what this graph is showing. And then, while we are still trying to get over things from 2020, this graph also shows that we had a federal budget stop that happened last October into November. And so directly from the website, so MDHHS was instructed by the USDA to temporarily pause issuance of 2025 November SNAP benefits, and that was due to federal government lapse at that time. And so I think that that's why we see the 2025 number being as high as it was last fall. All right, and then, okay, I know at my house, we spend more than $5.68 a day for food for all of us, but that's how much the average is for SNAP recipients. $5.68 per day per person. So I would encourage you to just try that, see how that goes for you. Because, SNAP helps over 1.4 million Michiganders, which is almost 13% of our state of Michigan households. That's a lot of people with a very small amount of money to try and feed themselves. So now I think the rest are for Andrea.
Good morning. My name is Andrea Conquest. I'm the Executive Director of Greater Midland North and Coleman Family Centers. With the Food and Health Group, we have identified 5 of our largest opportunities of how we can continue to serve our community members. The first being strengthening and aligning partnerships. We have over 30 partners in our group currently, but we are continuing to work with more in the community to be able to align, set the same goals, and to serve more community members through the partnerships. Next, we're working to expand access through infrastructure and innovation. We are working to get more food in our doors, but in order to bring in more food, we need to be able to store the food, work on getting cold refrigeration for that food. But by getting the food out to the facilities, especially the family centers, West, North, and Coleman, we're able to serve those in the rural communities who might not be able to come to the food in the city of Midland. We are working to center equity, inclusion, and nutrition. Food should be available for everyone. If you're struggling for a day, a week, a month, a year, it has to be there, it has to be available for everyone. Again, especially in those rural communities. We're working to improve awareness and reducing the stigma. We have a lot of great programs here in Midland of dispersing food, but a lot of people don't know about it. A lot of partner agencies can't tell those that come in asking for help about the different programs. So we want to increase the awareness, decrease the stigma that if you have to ask for food, it doesn't mean that you're failing at something, it just means you need help in that moment. We're looking to address the root cause of why there might be food insecurities. By addressing those root causes, can we help with income stability, with housing, with childcare? what are they might be paying for that they're putting their funds towards and not towards food in order to continue with their daily living. Some of our accomplishments with the Food and Health Group is that we have, in the past year, fully aligned with the Health and Human Service Council agenda. So we're changing our topics, we're changing our focus to better align to meet the needs of the community. This last fall, as Emily spoke about with the SNAP benefit crisis, we went from meeting every 6 to 8 weeks to meeting on a weekly basis to be able to discuss what's coming from policy making that changes close to daily back in the fall time of, are people going to have benefits? Are they going to be able to get food that week? So we met weekly to discuss those. Also, we teamed up with our Regrow Together. We were able to double our production of meals for the community. We worked with community partners to bring in close to $12,000 that was able to provide additional mobile food distributions. With support of Hidden Harvest of their collection of food, they also helped us in the Santa Parade in dispersing information on how the community can help us and also other programs that we can have to help the community. The $12,000, as I said, it was able to help with mobile food distributions. We served an additional 9 mobile food distributions at West Midland Family Center, North Family Center, and Coleman Family Center. Those 9 mobile distributions were able to help over 2,200 families in our community. That's a huge number, and like I said, that's families, so each family could consist from 2 to 4, so just times that number, and it's a huge help. Like I mentioned in the Santa Parade, that was a lot of eyes that were able to look at what services are available. We had QR codes, we were handing out information, just making it aware and reducing the stigma of what's available. As I mentioned, our Regrow Together program, we have distributed over 57,000 meals in Midland County through Regrow Together. For those of you that don't know, Regrow Together goes and rescues food. We upcycle the food. We work with Hidden Harvest, McFan, and other partners to bring in the food to culinary programs where over 40+ students are able to work with different ingredients, learn how to prepare and produce quality meals. We work with the Arnold Center, Wendover High School, and the Coleman Culinary Depot to produce these meals for the community. Once the meals are produced and packaged up, they are then distributed to different distribution sites, with West Family Center, North Family Center, Coleman Family Center, and Delta College being the distribution sites on close to a weekly basis now. We're able to distribute over 150 meals to the community. These are pre-made meals that they can be heated up. A lot of times, even in the family centers, we heat them up for them, so that way they have a hot, nutritious, and delicious meal. A lot of times we give the food out to these community members, but we don't think that they might not have a microwave. They might be living outdoors. They might not make it to a warm place until later that evening, so they don't have refrigeration to store the food. They need to eat it right away. So we're trying to make the access to food as easy as possible. With the Regrow Together program, we have saved over 34.2 tons of food that would have gone to the landfill. Instead, it was redistributed out into the community. Actions you can take to help us with our food and health program. Everyone here, we ask that you check in your cupboards. What can you donate to pantries? What can be brought into community cupboards? And if you don't have items to donate, can you donate your time? Can you come and volunteer at mobile food distributions, volunteer in shelters, help prepare food at meal distributions? Everyone is available. If you're able to host something with your work, that'd be great. With churches, contact any of the family centers, McFan, United Way, and we can get you in contact with the right people. Lend your voice in policy making. There's a lot of changes in policy. As you heard, there's a lot of need out there. So if you have that chance to have conversations, make sure you tell the need that's out there. And then also elevate the awareness of 211 that we have for the community. 211 is a great resource if you need help from mental well-being to food resource. Always direct clients, family members, community members to 211 to be able to get the resources they need.
All right. Well, thank you very much. A lot of what we hope you found was valuable information. We do have a few minutes for questions. If anybody has anything that they'd like to ask any of our panel members this morning. Don't all rush at once. All right, well, I do want to, on behalf of the council, thank all of you for attending today. Those of you, again, that are live in person, as well as those viewing on MCTV. Again, this presentation will be available on MCTV for a period of time. If you've had others that might want to take a look at it. You also can obtain further information about the council on our website, the Health and Human Services Council of Midland County, also our Facebook page. We keep information. If you're seeking out information or do have questions to ask any member of the council. The council is also available if you have an organization that's interested in one of these topics or the other ones we work with. We are available to give presentations or to answer your questions. I get asked fairly regularly what makes Midland County so special, and you can talk about, we have a number of great institutions. We have our schools, our parks, our community centers, the soccer club, Dow Gardens. We have so many organizations that make this community go. But to me, it's an easy answer. It's the people of this community that make it special. We get together, we identify issues, and we work together to resolve those. And so, again, we do have a call to action for all of you. I know that all of you are people that are care and involved in our community. You can review our impact report. We can get printed copies from United Way, but also it's available on our website. Again, you can follow us on Facebook. You can keep updated on community data, such as we've presented here today. Again, we are available for presentations. And as I think just about everybody mentioned, 211, it's a tremendous community resource. We have one of the best around. In fact, we lost our director to the state organization because it was so good. But we had good people that jumped right in there. It really is a conduit to just about anything and everything that you need to know about to support our services. So again, on behalf of the council, we thank you all very much, and we hope you enjoy your day. Thank you.